everyone, and welcome back to the Brainy Boomer Lecture Series. We're so very happy that you've all joined us today. We would like to begin by acknowledging that the McGill University Research Center for Studies in Aging is located and our work is done on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters on which we gather today. Tiohtià:ke, commonly known as Montreal, is historically known as a gathering place for many Indigenous peoples. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationship with Indigenous and other peoples who we serve within the Montreal community. Today's event is brought to you in collaboration with the Italian-Canadian Community Services of Quebec. In 2007, the McGill University Research Center for Studies in Aging, or the MCSA Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSA Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of their needs. To enhance the positive image of the aging process by addressing stereotypes and myths about aging. And finally, the dissemination of research on aging. Today's session will be presented by a group of nurses who are currently completing their final semester of a bachelor's in nursing program at McGill University. For their final project, which focuses on community nursing, they chose to explore the topic of social isolation in the aging population. They will be working with the Almaj Community Organization to provide education on the negative effects of social isolation, as well as discussing strategies to reduce its incidence and repercussions. Before continuing, we would like to remind you to please mute your microphone on Zoom, and that if you have any questions, you could either write them down in the chat box on Zoom or wait until the end of the presentation to ask them. And now I'd like to invite our presenters to start their event.
So hi, as Caitlin introduced us earlier, we're the nursing students from McGill, and we're here with you with our presentation, fighting social isolation together.
So we'll just introduce ourselves briefly. I'm Giovanni.
Jennifer.
I'm Bilal.
I'm Daniel.
I'm Andrea.
I'm Florence.
So before we begin, we just want to make it open and clear that although we strive to provide the most accurate and best information possible, errors or omissions can unintentionally occur. All right. So before we get into the topic of social isolation, we'd like you to reflect on how you felt in the past or during the COVID-19 pandemic. Feelings like sadness, loneliness, anxiety, can be present during different periods of our lives. Everyone experiences negative feelings or emotions like the ones listed here on this slide. However, we don't always understand why we feel them or know what to do with them. So in this presentation, we'll discuss the feelings around social isolation. We'll also teach you how to recognize the signs and symptoms within yourself and others around you, as well as how to address it.
Sorry about that. So how has the pandemic affected you? As we're all aware, COVID-19 has had many effects on all of us, no matter our age, gender, or location in the world. We have all been affected by the pandemic in different ways. After all, we're all different people. In the aging community particularly, COVID-19 and the safety measures that were and currently are set in place have had a negative impact on mental health. And many, especially at the beginning of the pandemic, many either that are at home or in long-term care facilities couldn't see their friends or families for long periods of time. And this can cause feelings like the ones mentioned in the previous slide.
So what does social isolation really means? The actual definition would be a state where there's a lack of significant social relationships, which is related to three elements. The first element is diversity, meaning the different types of interactions regarding the types of relationships, either family or close friends, opposing to less known people such as the neighbors, the mailman, and so on. Also, it could be related to the age of people interacting with, meaning playing with kids or having a deep conversation with other adults. It also could be the amount of people interacting with, for example, an individual conversation or talking to a group of persons. The second element is the quality of the interaction, which means interactions where is it possible to be yourself, being able to express your emotions, fear, happiness, etc., plus being able to ask for help or being helpful. For example, being able to babysitting your grandkids. And the last element is the quantity, which can be calculated with two components. First, how much interaction you have over a certain period of time. It could be talking on the phone to your friend time to time or having visits from your family every day. And the second component is how long the interactions are. Is it a call of 5 minutes or a deep conversation of 2 hours? All those elements will dictate if you're living social isolation or not. In another hand, there is two kinds of social isolation. The first one is social isolation by choice, where the decision is made by the person himself willingly, and normally it is planned. It could be going to live on a countryside after work retirement, for example. But in this presentation, we will talk more about the second one, which is social isolation due to a lack of interactions that is related to multiple factors. We will talk about the risk factor later, but just so you can understand the meaning, I will give you an example. Let's say someone is unable to move due to a hip fracture. The person will have difficulty to leave in the house, to go eat with his friends, to go to the community organization for the weekly meeting, for example. If the person is currently working, this will usually lead to a loss of income that could have impacts on the capacity to spend money on activities. Also, the person could lose some relationships with his coworkers. So all those elements could lead to less interactions. In the next slide, we're going to discuss about the difference between loneliness and social isolation. This could be confusing sometimes, so let's explain that. Loneliness would be characterized by an emotional perception of lack of interactions. So, for example, someone could feel that he's having interactions because his only significant relationship was with his best friend who just passed away. Therefore, other interactions with neighbors, mailman, nurses, and so on have no value to him. In fact, he still has interactions, but he doesn't feel it that way. Whereas social isolation would be characterized by a real lack of social interactions. In this case, the person has few or non-interactions with people due to multiple reasons that will be mentioned in the further slides. So now let's take a look on some statistics. In Canada, 83% of women over 75 years old were living alone, whereas only 18% of men over 75 years old were living alone. Also, the percentage of women divorced over 65 years old is increasing, which can explain the percentage of women living alone, whereas the percentage of widowed men over 65 years old is decreasing, which can explain the percentage of men not living alone.
To have 80% of elders over 65 network. 32% of people who have been living with mental distress have sought out help from a physician, nurse, or psychologist. Men are less likely to reach out for help, and when they do, they are often in a deep state of distress. Healthcare professionals, which is HCP, are less likely to bring mental help to men. Due to behavioral norm and value from our society, men are looking for performance, wanting to be autonomous by resolving all their problems by themselves, valuing strength and feeling shameful of failure. Behaviors linked to femininity, such as expressing emotions and calling for help, are useful to seek assistance and to foster a social network.
Okay, so who is really at risk? So older adults are at increased risk of feeling isolated. This was an issue that was identified way before the COVID-19 pandemic. Only the pandemic made this issue worse. Older adults are at increased risk of loneliness because they often experience important life changes such as retirement, age-related health problems such as hearing, vision, and memory loss, disability, and trouble getting around, widowhood, children leaving the home, the loss of a friend or a family member. These changes make it more difficult to socialize. As we know, the best way to protect ourselves from the COVID-19 pandemic is to isolate at home, therefore making the issue of loneliness in people who are already feeling isolated even worse. Next, I'll be talking about the complications. So what are the complications? So people who are socially isolated or lonely are more likely to be admitted to the ER or to a nursing home. Social isolation is often associated with higher risk of high blood pressure, heart disease, obesity, weakened immune function, anxiety, depression, cognitive decline, dementia, including Alzheimer's disease, thoughts of suicide, and death. People who are socially isolated may get too little exercise, drink too much alcohol, smoke, and often don't sleep enough, which can further increase the risk of serious health conditions. Social isolation may also be bad for brain health. Social isolation has been linked to poor cognitive function and higher risk of dementia, including and especially for Alzheimer's disease. Also, little social activity and being alone most of the time may contribute to a decline in the ability to perform everyday tasks such as driving, paying bills, taking medications, and cooking. So next, I'll be talking about the signs, what to look for. So what are the signs of social isolation? So some of the signs are physical health changes such as bruising, weight loss, and weakness. These can be a result of declining health. Mental or emotional health changes, for example, fear or confusion. General lack of interest and acting withdrawn. Changes in personal hygiene or appearance. Changes in eating and nutritional status. Behavioral or personality changes. Poor living conditions, clutter, and hoarding. So next I'll be talking about the intervention. So what can be done to minimize the effects of socialization? So as we know, the most important one is connecting with others. So this can be done through telephone or video conversations or using online social media platforms such as Facebook, WhatsApp, FaceTime, or Zoom. Another beneficial intervention is psychological therapy interventions. For example, mindful-based therapies, Tai Chi online meditation classes, laughter therapy, and visual arts discussions. Next, we'll be talking about self-care strategies.
So some of these self-care strategies are part of the interventions, and they're important as they can lessen the negative effects of social isolation. So some of these self-care strategies include engaging in relaxing activities. These include exercise, stretching, reading, listening to music, meditating, praying, writing, and overall just doing hobbies that help relieve stress associated with isolation. Also, following a routine can help, as it helps to establish a sense of purpose and normalcy. Maintaining healthy habits are also part of self-care strategies, as eating well, getting enough sleep, engaging in physical activity does promote better mental health. You could also maintain social connection and overall just stay informed by being up to date regarding the current COVID-19 situation.
There is 3 resources available for social isolation. The first one is Info Social, Info Santé, which is the number is 811. It's available 24/7. It helps with grief, anxiety, and psychological issues. They can refer. The second resource is Tel Aîné. There is a number for Mercier Hochelaga Maisonneuve, the long one, and for Grand Montréal, it's 211. It's 60 years old and older. They do telephone listening and referral, follow-up calls, home meetings, and conferences. They also have an outreach work initiative for senior living in a vulnerable situation. And the last resource is Ami Quebec. There's the phone number. It's a resource for family, friends, caregivers of people suffering from mental illness. In terms of program and support, they have workshop, supergroup, counseling, online learning, education and outreach events, and hospital support.
So we have two cases that we're going to be presenting to, and we want you guys to reflect and see if you guys have ever felt this way, if you know someone who's ever felt this way. So here we have Maria, and she presents herself like this. I'm 67 years old and I live alone. My husband passed away 6 years ago, and we have 2 children and 4 grandchildren. They all try and visit as much as possible, but with the pandemic, it has been hard. My hobbies include baking with my friends, being part of the community book club, and going on neighborhood walks with my friends. But for the past 2 months, I've been having a hard time sleeping, and all my hobbies don't make me as happy anymore. With the restrictions slowly being lifted, I find myself saying yes to my friends when they ask me to come out for our walks or when we have our evening book club meetings. Even though I've been having a hard time with sleeping and my hobbies, I really do enjoy going out with my friends. Sometimes I find myself home alone, looking out the window with the radio on, but I pass the time with my friends and family. I still do my everyday tasks and cook my own meals and clean the house as usual. There hasn't been really any change in my routine. So, like, we're asking the audience here, have you guys ever felt the same way or something similar? And what do you think is happening with Maria? Okay. Well, I mean, as long as we all reflect, that's good. We can move on to the second case if no one has anything to say.
So for the next case, we have Giovanni, and this is how he presents himself. So I'm 85 years old and I live alone. I have 1 daughter and 3 grandchildren who live close by. Depending on the weather before the pandemic, I used to visit my friends at the nearby park or basically meet my friends. My wife Maria passed away 6 months ago. We were married for 60 years. She was my best friend, and I could not have asked to spend my life with a better partner than her. We traveled the world together and had a wonderful daughter. Since Maria has passed, I've only visited my friends a few times, but it did not feel the same as it did when Maria was there. Lately, I've had trouble sleeping, even though I feel so tired and don't feel like eating much. So, question for Giovanni. Have you or someone you know ever felt like this? And what do you think has happened to Giovanni?
So again, if anybody in the audience wants to participate, if not, you can just reflect on it, and then we'll review the 2 cases and explain what's going on. All right, so there's a clear difference and contrast between the 2 cases. In the first one, we have Maria, who is at risk of being socially isolated, but due to her support system and her daily routine, etc., she is not socially isolated, but there is a present risk. Whereas in Giovanni's case, he may be socially isolated after the death of his wife, and he's not leaving the house as much. He's not enjoying seeing his friends as much. So there's a contrast between the 2 cases. And these are examples that you might see within yourselves or people around you or with family members as well.
Sorry about that. Oh, wait. Okay, sorry. So how clean are your hands? We know that many of us are always being asked to wash our hands before entering a public environment, but not everyone knows why. And you may also be wondering what this has to do with social isolation. One of the biggest contributors to social isolation recently has been, of course, the COVID pandemic. So we want to make sure that when you interact with your friends and family to fight feelings of loneliness, but in a safe way. Hand washing is a great way to protect yourself and loved ones from germs and illnesses, and it takes 20 seconds it takes 20 seconds with soap and water, or 15 to 30 seconds with hand sanitizer. So we're gonna watch a short video on like hand washing, and yeah.
Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
All right. So we're going to send a link in the chat of the Zoom. We created an online survey. It shouldn't take too long to fill it out, but we would appreciate if you could fill it out so we can get your feedback on our presentation. It's very appreciated. All right. So we have references as well here. If anyone wants the references, Caitlin has a copy of the presentation. You can always email her or reach out to her to get a copy of the PowerPoint if you'd like as well.
And a copy of the pamphlet as well. I don't think we were able to show it, but we gave an electronic copy.
Yeah.
And there's a little crossword somewhere if you guys like that stuff.